Welcome to the Green Wisdom Health Podcast with Dr. Stephen and Janet Lewis, where you will learn about natural solutions to common ailments. And now, here are your hosts, Dr. Stephen and Janet Lewis.
Hello and welcome to the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And today we are going to discuss heavy metal toxicity. The name of this show is called Symptoms of Heavy Metal Toxicity. Dr. Lewis, can you tell us why you felt the need to discuss heavy metals? He's thinking about why he's discussing heavy metals.
It goes back to the 70s and the music, but no, not really. Well, you know, I've talked about being toxic off and on for many, many years, even before we got into this, and I noticed that as I tried to fix people's joint pain, nerve pain, musculoskeletal pain, that if I would put people on something that could displace toxins, heavy metals and others, that their pain would get much, much better, much more quickly. They could achieve, or we could achieve the goals with fewer adjustments and less time. So I think we should always be taking enough nutrients to help our bodies detox, not just metals, but other things. And the side effect of being cleaner is deep sleep. Most of us don't get the deep restorative sleep, which not having good sleep actually helps induce leaky gut, which we've talked about, and that can lead to insulin resistance. So when we talk insulin resistance, we're talking about pre-diabetic or diabetic, and it can lack of the sleep can lead to actually autoimmune disorders. We're seeing more and more autoimmune disorders, and people say, well, what's chiropractor doing talking about autoimmune disorders? Well, guess what? That has a lot to do with osteoarthritis, which I've already got most of that podcast written for the future about how osteoarthritis can be helped with nutrients as well as the chiropractic adjustments. But to get deep restorative sleep puts you in a better position to detox, and heavy metal is a big part of that.
You know, I think a lot of people out there don't really realize they're even exposed to heavy metals, and they're probably thinking, well, I'm not around any of that, so I'm not really sure how it pertains to me. But, you know, there's good metals like zinc and copper and iron that are beneficial for your health, but there's also some very toxic ones like cadmium, arsenic, chromium, lead, mercury. You know, and people are like, well,
aluminum.
Yeah, and where do you get those bad ones from? You know, is everyone exposed to one or more of those?
Absolutely. And people say, I'm not exposed to that. It's like, yeah, you are. You just don't know it. I mean, if you walked into a newly sprayed building that's had pesticides in it, or even new building materials, or the outgassing of carpets, and those are not necessarily metals, but they can be benzene and styrene and styrofoam cups. There's so many toxins in the world. If you're not exposed to it, why do the polar bears have thyroid problems and osteoporosis? We don't spray anything up there. And, you know, we'll probably go over a list today. And I've always said, please don't try to diagnose yourself at all. But if you don't diagnose yourself off this list, because of these lists that, you know, we may say, well, this is hypothyroidism. Well, it can also be leaky gut. It can be chronic fatigue syndrome. And, you know, I had a kid one time, young man, who was not very developed, and you could tell he had some problems. And he brought me a book and says, here, what do you think about it? And it was only focused on mercury. I said, well, mercury is a bad thing. And if you're drinking or eating anything with high fructose corn syrup, you are getting mercury. It's that bad. High fructose corn syrup. And it's not just people say, well, I don't drink soft drinks. Well, it's in your ketchup and barbecue sauce. Check the ingredients. But it's got too much mercury in it. So I told this guy, a young man, I said, yeah, taking out the mercury is a good thing. And I read the book. It was a pretty good book. But I said, the problem is there's so many chemicals in our environment, and there's about 5 new ones each day that join the 80 to 85,000. And that includes anti-inflammatory drugs and antibiotics, and that can have a very negative effect effect on the health of your intestinal flora. So when we talk about detox, I try to skim over it because Janet says sometimes I get too technical. It's like, well, they're smarter people than me, but I'm really good practitioner. So, we talk about liver methylation, sulfation, acetylation. There's a lot of different liver detox pathways. We don't talk about the P450 cytochrome pathway very much, but you have to have extra nutrients in order to allow your body to kick that in gear, because you do not get enough nutrients out of your food. It's impossible. You cannot do it. So 80 to 85,000 different toxins in our environment, and many of those are metals.
Well, and then to make it in a little simpler form for some of us that don't understand all the scientific words, like myself, there are some common symptoms that you could experience if your body is high in toxic metals. One of them is headaches, abdominal pain.
Especially the headaches in the morning.
Oh, really? Why the morning?
Because, that's when the body's geared to dump, colon especially, and bladder. And most of us are behind. That's why Janet's famous for her, well, if you've got 3 trains going into a tunnel, how many trains should come out? That means if you're eating 3 meals, you need to have 2 or 3 bowel movements per day.
That makes sense, because that's 5 to 7 in the morning, the Chinese body clock.
Yeah, that's the meridian. And the thing about it is, it's complicated, and I'm not being glib when I tell people we've made an intelligent, educated decision about what you should take when you should take it, but then you need to throw it in and let God sort it out, because one of the things that's killing us faster than anything is the stress over trying to do it perfectly, or the stress over trying to do it halfway. So we'll make a good decision, and I tell my patients, use your discerning spirit or your intuition, and then follow up and never lose your faith.
Some more symptoms of toxicity in your body from heavy metals is nausea, vomiting, diarrhea, fatigue, chills, and a general feeling of weakness.
One of the complaints that I've heard just a few times, well, I got on your supplements and I had diarrhea or I had loose stools. And I said, well, we can slow it down, but can you realize that that's your body trying? It has the nutritional aspect to increase detoxification. That's your body trying to detox. Now, we can slow it down and make it comfortable. That's very important. But for God's sake, don't quit. That's a good thing. People say, but I'm not comfortable taking this. I said, well, throwing up makes me sick. I mean, I'm ugly. UGLY. I'm ugly when I throw up, but I know that's a good thing because my body's getting rid of toxins.
Yeah, that is something that a lot of our clients say is like, well, this made me uncomfortable. I'm having a little more diarrhea. It smells bad. I'm not used to going to the bathroom this much. It is very common that our supplements will start dragging out toxic things. You have to think about if it's not coming out and it's just sitting there and then you don't do anything with it for years. What does that lead to down the road?
We had a lady, I don't know if it's early this week, late last week, said my urine stinks to high heaven. And she was kind of embarrassed to say that. And it's like, well, that's a good thing. Here's the thing. People say, but my son, I heard this, my son has acne. And I said, well, he's not pooping enough. Well, he poops once or twice a week. I said, well, the primary channels of elimination is through the colon and through the bladder, urinary tract and colon. And if you're not getting it out fast enough, it's going to try to come out through the skin. That's a secondary path of elimination.
Mm-hmm. It's true. And more severe and chronic cases of heavy metal poisoning include burning and tingling sensations, brain fog, insomnia, paralysis, and chronic infections. And that seems to be, we're hearing more and more people telling us they're having the burning and tingling sensation and a lot of brain fog. So, possibly it's heavy metal issues that need to be dealt with. So I guess, if you have this in your body, is there a way to pull these things out? Do you have certain supplements that pull those type things out, Dr. Lewis?
We talked the other day when I think it was Casey that was here, that there are definitely some things that you can take. The Enviro Detox is very, very popular with our people. It's got the zeolite clay, the activated charcoal, shilajit, which is fulvic acid and humic acid. Shilajit's a really incredible product. That works really, really well. And I tell people, then you need to go through the multi-minerals, but you want to do it at a different time because you want to make sure that the activated charcoal and zeolite's not getting the good minerals. I'm a big fan of our active mega multi, and it's got some good minerals in it, but just as a matter of real estate, so to speak, the amount of room that it takes, it's good to take not just the multivitamin, but the multi-minerals also. Ours has calcium, magnesium, zinc, selenium, manganese, chromium, molybdenum, potassium, vanadyl sulfate, which is great for blood sugar and insulin resistance. And then boron. Folks, if you don't get enough boron, you can't have strong bones, especially if you're a woman. Men, if you don't have enough boron, which is almost impossible to get out of your diet, you can't build testosterone. Woo! They perked up when they heard testosterone. So the minerals are a really, really good thing. It's a smart thing, but it helps to bind with these heavy metals. And I said manganese. Well, manganese, it depends on the form. I've talked about research where welders that were exposed to the fumes had higher levels of manganese and then higher neurodegenerative effects, meaning abnormal effects on the nervous system, but it's the wrong form of manganese. So you have to be careful. And I've talked about this over and over again. I'm going to keep doing it. When it says TRAACS, TRAACS, which ours is, in every time that it's possible, that stands for the real amino acid chelate system, and you get up to 20 times more absorbable.
One of my favorite ones is our reduced glutathione, and Dr. Lewis can tell you exactly why it works, but I know that it helps immune system also by detoxifying and gives energy. So that one is really good. It's quick. I know that if you do too much of it and you don't do something about it, it can build up and not come out well. I mean, I know that. It's like you can overdo glutathione as well, right?
Well, you have to make sure you're drinking a lot of water. Water is the universal solvent. They taught me that in chemistry a million years ago. Alcohol is a solution, but water's the universal solvent, so don't think vodka's the other clear drink. It's water, and it needs to be filtered. Reverse osmosis is my preference. But so you have to make sure that when you're giving your body the nutrition for it to crank up the mitochondria or the energy producers so that it binds these toxins or conjugates them. That happens in the liver. That's why I always pay attention to liver for those of you that are patients. You've got to make sure that it's going through. So if you have thick bile, then I will recommend taurine because it thins the bile. And if you thin it, then it goes through your fatty liver, which many of us have because of decades of too much high fructose corn syrup and mercury. When it thins the bile, it goes through the liver, through the gallbladder, and squishes out into the small intestine more readily. So it detoxes a lot faster, but you have to have a massive amount of good probiotics in the small intestine because the probiotics actually affect, in a good way, the microbiome of the small intestine, and that has to do with conjugating and keeping these conjugated harmful products from unconjugating and becoming toxic and being reabsorbed. So that's why good bowel movements and fiber is super, super important, because this glutathione Some people call it the master antioxidant. I think, I'm going to get in trouble for this, but I think sometimes Janet has a tendency to, oh yeah, she's looking at me.
I'm waiting to see what I've done now.
No, I'm waiting to see what kind of trouble I'm creating for myself. But I think sometimes she overdoses on things. She gets really excited, and she was taking, I said, you know, you're 5'4", 130 pounds. And she says, Stephen, I'm not that fat. And I said, okay, well, I think 3 glutathione might be a bit much, honey. Please, I'm sorry for whatever I did. But glutathione is incredible for detoxification. And as you detoxify, you increase your immune system health. Immune activation. And as you do that, you're less prone to have the autoimmune diseases that we see develop more and more and more.
That really does help brain fog, though. I can tell you that. The reduced glutathione really helps quickly to reduce the brain fog.
Yeah, and to tie this together, because many of you that are listening are already patients, I tell people, well, if you have brain fog, it's usually because you have too much candida, and that's they create something called thymidase and steal, or have you have the inability to utilize thiamine that you don't get enough of anyway. So that goes back to, if you have all these things going on, and bad metals are famous for adversely affecting the microbiome, and that's why candida can go into overgrowth, and that's why you have to promote the use of and the growth of good probiotics, and you have to be consistent with it, because even glyphosate, that people say, oh, glyphosate's not bad for you. Bull. We got most Vietnam veterans are dead because of Agent Orange. Look up glyphosate and Agent Orange and compare the two. It changes the glyphosate in our foods, changes the microbiome, which lets the candida go ballistic, which steals your thiamine, which causes brain fog. And brain fog can be just from, oh my God, I got too much aluminum. You get aluminum because we're consuming it out of our canned goods, and these fast foods. Mm-hmm. Hang on, I had a sneeze.
Oh, I thought he was going to whisper to me. Bless you.
Most of these prepackaged, I'm trying to sneeze. That's another avenue of detoxification. But most of our foods that we buy that are prepackaged are cooked in huge aluminum vats. Think about that for a minute. Mercury. I had 2 different dentists that would get the mercury amalgam fillings out of my teeth, and both of them thought I was bat crazy. But I felt better. Now, was that all in my head, or was it because I got more mercury out of my system? Now, one of them just took it out, drilled it out, and of course you're inhaling those vapors, and I got sick, and my liver enzymes went crazy high. The other dentist was much more meticulous. She loves that word, and she's an incredible persnickety, perfectionist, meticulous dentist. She used the rubber dam and got the rest of my amalgam fillings out, and I didn't get sick at all. So I got the mercury out. Now, whether it's in my head or real, I don't know, but I felt better. And my headaches went way, way down in frequency. Janet mentioned headaches, and my blood pressure went way down.
Well, and you get a lot of the mercury, too, out of the different kinds of fish that you eat, correct? I know, like the larger fish, like swordfish, king mackerel, tuna, marlin, are all bigger carriers of mercury. Because
they have more time to bioaccumulate as they're eating the little fish, and it just bioaccumulates in the body. And I kind of like tuna, but we make sure we buy the young, smaller tuna.
The young tuna?
Yeah. We do.
I never looked at I guess I always let you pick that out. So I guess we're buying baby tuna. I don't know.
Yeah, we eat baby tuna.
I know on salmon that little
the fat strap.
Oh, that brown thing at the bottom. I used to think you were supposed to eat that, and the first time when Steve and I first started dating, he goes, "Why are you eating that?" And I said, "What's part of the salmon?" He goes, "That's where all the metals are stored, all the toxins." And I was like, oh my God, now I can't stand it.
It's that little colored
brown strip.
Yeah, and I don't know why these chefs don't scoop it out with a spoon, but I cut it out.
Yeah.
You're going to help yourself if you just do that much. And I like research. Polluted air causes high blood pressure, and in the polluted air are many of these heavy metals. And even the American Journal of Public Health says that polluted air raises blood pressure. There's actually a lot of studies done on even low doses of heavy metals and how they disrupt the structure and the function of platelets. Platelets are about clotting. It helps plaque occur much more likely, and that's not a good thing. That's from the Journal of Environmental Pathology, Toxicology, and Oncology. So even low doses, and we get the mercury we get from high fructose corn syrup, from big fish. We get a lot of aluminum from processed foods.
And arsenic is actually in high levels of it are in rice.
It really is. And I do more rice now because I found out how horrible gluten treats me, but I still try to reduce it somewhat. Yeah, arsenic is bioaccumulated in the rice fields.
And then your cosmetics and body care products are, they have numerous heavy metals like lead, cadmium, and aluminum. You always hear about that in the deodorants. That you're putting aluminum right in the soft tissue of your arm. I mean, it's going right into your body. So we always try to use, something different. Like we use Pretty Frank deodorant. We get it our local natural health food store here. You just need to try to avoid as much of the chemical stuff that you're putting on the outside of your body with soaps and all of that kind of stuff, because that's just toxins you're trying to get rid of.
Yeah, and there's some people that would tell you that the aluminum has a lot to do with breast cancer. I'm not going to say that's true, but I've read things that had a pretty good case to that effect, because it'll be absorbed and not be pushed through the lymphatic system.
Yeah, and I see people cooking with aluminum pans still, and I'm thinking, are they still really around? Because I remember my grandmother used to have aluminum pans. Lord only knows what they got from that. The Teflon pans. That's another one, because they're full of a bunch of chemicals also. And then you look at the pan later, and there's like pieces of the pan missing. So you've not only got some of that, you also ate it. And people are like, well, how is you supposed to keep things from sticking to your pans without those? Like, oh Lord, use stainless steel.
Cast iron or stainless steel or glass.
Yeah, and then there's also foods that can help you detoxify naturally, like cilantro. We have a lot of cilantro in Texas. We like it.
It's really good, and that's because of the Hispanic influence. And Janet mentioned cadmium. Well, we have cadmium batteries, welders, fabricated metal products. Those people have about 4 times the increased incidence of prostate cancer compared to the average guy, and that's because of the cadmium, which also you get if you smoke.
Who are these people? What people?
People that fabricate metal products and welders.
Oh, yeah. That smelled inhaled all of that for all that time?
Yeah, 4 times the incidence. And that means that welders, people that fabricate need to take more of the heavy metals, or the enviro detox, the multi-minerals. The glutathione really is, they say, the master antioxidant. And folks, it's prostate. Only one R. People say prostrate. It's like, no. That's a whole different word. I'm sorry. You're not supposed to correct people.
And the bug exterminator people are full of them also. I know that.
Yeah, and they have more of a tendency toward neurodegenerative diseases like Parkinson's and Alzheimer's, different types of dementia.
And spraying the inside of our house with those things also.
Yeah, which we pretty generally don't happen, except she saw a roach this morning. It's like, holy jeez. If we do have them spray with chemicals, we take the dog and go on a long trip. And then we have some air cleaners, and then we have holistic, more natural cleaning products that our maid uses. So some of the things that happen because of these excess metals, and again, we're talking about 80-something thousand different toxins, which is not just metals, but that creates what you think is a disease of aging. It's not really a disease of aging, it's a disease of accumulation.
Mm-hmm. So use things like cilantro, garlic, lemon water, drink green tea. All of those things are really good at detoxifying heavy metals. And Dr. Lewis, I know we got several things happening here, but we've had some people ask about our new programs. We just got it put on our website. There are 30-day programs. I guess you can explain what you decided you want. The reason you added these in, we've got 4 of them. There's one for weight loss, there's one for energy, there's one for hormones, and there's one for thyroid. And can you explain why you decided that maybe people needed help and added these programs to our site?
Yeah, because those of you that have used our services, and thank God, literally, I have so many people that continually do this, like Richard and Rebecca in California, like Alan from Maine. I could go on and on talking about people that do that. But some people say, well, what should I eat? What should I not eat? And it's like, I'm like, read a book.
Well, a lot of them want to know if we have a dietitian.
I'm so overwhelmed. I'm incredibly busy, and I'm glad because there are people that are getting well. So instead of telling y'all to read a book, we have created an integrative nutrition concierge team. That's the technical term.
So you don't have to read a book. They'll do it for you.
Yeah. These people that we've teamed up with what it is, a functional medicine registered dietitian and a certified nutrition coach, and we have ways that you can take pictures of your food, and on this app it saves you time, and it's not really so much a diet, but it's a way of eating that will have more of the nutrients that will support, for example, weight loss or energy or hormones or thyroid, whichever one you choose. We have a few supplements to go with that to get you going, because there's some people said, well, I don't want to take 8 or 10 or 12 different nutritional supplements. It's like the smart ones, the ones that get the best results, are the ones that do this program and take even more nutritional supplements. And that way,
well, it helps you shop for the right foods. It's a cost-effective way to eat. Because a lot of the people, when we do their labs, they're trying to eat right. They're trying to do the right things, and they honestly don't know which things are not good for their particular issue, whether it's weight or thyroid or hormones.
Yeah.
And these nutrient plans are based on you getting those particular issues under control.
So it's not really such a diet, but it's nutrient-dense eating, and it makes it easier. The meal plans, the recipes, they're all quick, easy, and inexpensive. That's the key.
You get weekly calls with the coaches. You get in-app messaging anytime. You take pictures of your food. They help you figure out, well, why did I not feel good that day? Or maybe you've got a big party or something coming up and you're trying to do the right things, but you don't know what it is you can eat. They're there to help you. And the people that have already...
Janet and I are overseeing this.
Right. Yeah, that's what I would say. The people that are already doing our programs, there's couples out there that do our programs together. If you're having the same issues, you could literally get one program and both of you learn how to eat differently and have recipes and that kind of thing. You don't do it forever. It's 30 days. You learn how to change your habits, and then you can go forward with that and do the right kinds of food and things, and it'll help you get better with the nutrition that we're doing on this side even faster. And with each of these programs, we have some complementary products that come in the packages. They're different for each of the programs, but you can go on greenwisdomhealth.com. There's a tab there that says 30-day programs. You can read about it. They're pretty outstanding. We're pretty impressed with all the people we've employed, and
It takes a lot to impress me, I promise you. We've had many people try to team with us, and I'm like, nah, ain't going to happen.
So you're getting a whole lot of value for what it costs. Is that? I guess that's a good way to put it.
That's a better way than I was going to say. I was just going to say I'm blown away with what they can add to your life and your health and your energy and your thyroid function, et cetera, et cetera.
Yeah, and we literally have some patients that are due for lab work again, and we're telling them, hey, we really think this 30-day program might behoove you to do that before you do lab because you can see tendencies that the people don't really know what to eat or what to purchase, and we don't want you to keep making the same wrong choices and then having to buy more products all the time. We'd like you to learn how to change that. So that's what all this is about. And gosh, we've come to the end of our show, Dr. Lewis. I can't believe it. So along with not being toxic from heavy metals anymore and getting a new lease on life here with eating, is there any final words that you'd like to leave for us this week?
Well, one thing I'd like to say is that we're doing our best to get back to doing more podcasts. We have people say, well, I wish you'd put out more podcasts. And it's like, yeah, it's been a crazy 2 years. And
and my dad's had some health issues, so we were trying to make sure we were there for that. But he's all good now. Got him a new heart valve and ready to roll, so we hopefully get back on schedule with some of that.
And his surgeons at Baylor, Scott and White, and I love the medical profession, I always have, but they said, we don't understand why this went as quickly and as smoothly on an 85-year-old man. Well, he's 85 going on 60, but we know for a fact it's because Janet keeps him jacked up on some really good supplements all the time. Folks, two more things. Number one, I can see things coming months, sometimes years before they happen. There's been plenty of people that stocked up because of the supply chain issues, and it turned out to be a really wise choice on your part. Here's the other thing. We talked briefly about autoimmune diseases. Folks, it's really, really time to get serious with your health. You need to make an investment in your health for reasons I won't go into. Now's the time and the opportunity to get started and get a healthier immune system. It's getting to the point where it may be too late real quick, so get started now so that you can make it through any challenges that may be thrown our way. And I want you to understand, even though it's been a crazy, stressful 2 years or 2.5 years, our stress should not be embalmed. It should be cremated. So burn it and let it go.
I like that. We thank you for listening to this week's show. If you're new to our podcast, please go to greenwisdomhealth.com. You can click on the health survey and get started. If you have questions about what you need to do, let Dr. Lewis give you a call. We can help you through any of that. It will recommend you a lab panel, and we try to make it as easy as possible for you. We will be here next time on the Green Wisdom Health Show.
Once again, our show has come to an end, but your hope in your health is only beginning. If you or a loved one are in need of a different outcome and are waiting for a brighter future, take the first step and go to our website and fill out the health survey. Please don't keep us a secret. If you know someone that could benefit from this podcast, please share this show with your friends and family. You're only one step away from a life worth living.